Um, Good afternoon, my people. This is Ishmael Mbithi again, coming to you live. As I promised that this week we are resuming our healthy talks, and on behalf of MIVHT, that is MTUMISHI Ishmael Volunteer Health Talks, we are presenting to you a healthy episode, and I believe that you are going to love it. You are going to enjoy it, and you are going to learn something. MIVHT is committed to bringing to you health talks, creating health awareness, because prevention is better than cure. And so our goal is to make sure that we have a very better, safer, and a healthier society. And we believe that through these talks, we are going to transform lives out there. We are going to change our societies for good. And therefore today, we have a very interesting topic, which is about oligospermia. Oligospermia. And oligospermia is also referred to low sperm count. Low sperm count. So low sperm count is what we are calling oligospermia. And what is it? Maybe you have heard of low sperm count somewhere. You have heard people discuss about it. And I believe that you have an idea. But if you don't have an idea, don't worry. Because today you are going to know about oligospermia, or rather the low sperm count. So low sperm count refers to fewer sperms in the semen after ejaculation. Refers to fewer sperms in the semen after ejaculation. So what is semen? Maybe we can start there. Semen is that fluid that a man ejaculates. That liquid, that fluid that a man ejaculates is what we are calling semen. So the fluid that you are seeing is not sperms. It is a fluid called semen. But inside the semen, we have sperms. Sperms are the male cells, or the male eggs. Yes, that is the best word there. Sperms are the male eggs, which are used to fertilize ova or ovum from a female. And so low sperm count is that limited number of sperms in a semen, in semen. And sometimes that semen may totally have no sperms. So that complete absence of sperms in semen is called azoospermia. That complete sperms may lack, the semen may lack sperms. Like when you take a sample or a milliliter of semen, you may totally find nothing, no sperm. I believe that you have a clue of what a sperm looks like. It has the head, it has the middle piece, and it has the tail. So when you take a milliliter of semen, you may fail to have sperms at all. And this condition is called azoospermia or azoospermia. So low sperm count is called oligospermia, that limited number or fewer number than normal. And what we are saying is, when you have, okay, maybe I will start by saying the normal ranges. So the normal values, or the normal levels of sperms in a milliliter, mark this, in a milliliter of semen, it should be 15 million to greater than 200 million sperms per milliliter of semen. So between 15 million and 200, even more than 200 million sperms per milliliter, ml, just 1 ml of semen, that is normal. I want to repeat this. The normal ranges of sperms in 1 milliliter of semen it should be 15 million to 200 million or greater than 200 million sperms per milliliter of semen. Semen, we said, it is the fluid that contains the sperms. And so what we are calling the low sperm count is any value of sperms in a milliliter of semen which is less than 15 million. So anything that is less than 15 million now, it is low sperm count. I don't know whether we are together up to that point. And therefore, low sperm count is something which is very risky. And the main risk of low sperm count is infertility. Yes, the main risk of low sperm count is infertility. That inability to sire children, that inability to bring forth to a new generation. So that is basically the main risk, and I hope you are following. So how do you know? How do you know that most likely you have a low sperm count? So some of the symptoms may include problems with sexual functioning. I want you to get me clearly. So problems with sexual functioning. What are some of these problems with sexual functioning? For example, low sex drive. Low sex drive, like you don't have interest in sex, or it's very reduced. You don't have interest at all, or it is very reduced. So that may be an indication that you have low sperm count. Another thing is difficulties in maintaining an erection. You remember what we call erection, For a man to ejaculate, for a man to ejaculate the semen and the sperms, then the penis must be erect. So if a man has problems with maintaining an erection, then it means most likely he has problems with a low sperm count. The good example is ED or impotence. ED is erectile dysfunction. It is also called impotence. So if you have ED, it means you have problems with maintaining an erection. You may also have problems with erecting. There is a difference between erecting and maintaining an erection. Maintaining means it has already occurred. It has already occurred. So what I'm saying here is you may have a problem with starting it and also maintaining it. So those are some of the symptoms. We may also have some pain. You may experience some pain in one or both of your testicles. You may experience pain, piercing pain. You may experience some swelling, or when you touch your testicles, you feel some lumps, yes, some growths, something which is very hard, some areas of tenderness inside your testicles. So it means you may have a problem which can lead to low sperm count. I don't know whether we are together up to that point. And so I want also to discuss about the risk factors. What are some of the factors that can increase chances of having this low sperm count? You men, listen to me carefully, because it is the problem concerning men. So what are some of the risk factors that can lead to a man having oligospermia or low sperm count? And one of the risk factors is smoking tobacco. Smoking cigarettes, tobacco. It's very dangerous. So that is one of the main, one of the risk factors. People who smoke, smoking cigarettes, smoking marijuana, smoking banky, and those things, it is very dangerous. The other risk factor is alcoholism, taking alcohol. Alcohol, for your information, it is associated with any medical condition. In my areas or in my practice in the medical field, I've never seen a medical condition where alcohol is not involved. So this is one of the major contributing factors to many other medical conditions. Remember, this alcohol is also contributing to liver cirrhosis, a disease of the liver. So alcohol is very dangerous. It can also lead to what we are discussing today, and this is low sperm count. Also, low sperm count can come as a result of stress. Stress which can translate to depression. People who are severely depressed are at a higher risk of contracting or developing this oligospermia, which is low sperm count. And also another risk factor, we can say infections which affect your testicles. For example, orchitis. Orchitis is inflammation of one or both of your testicles. So where there is swelling of one or both of your testicles, then it means the process of sperm production, the spermatogenesis, is going to be interfered with. So this infection leading to orchitis, the inflammation, the swelling of the testicles, will interfere with sperm production, and at the end of the day, we'll have a low sperm count. We can also have another infection like epididymitis, which is inflammation of the epididymis. Epididymis is where the sperms are stored. After production, after the sperms are produced in the seminiferous tubules of the testicles, then they are stored in the epididymis. So when the epididymis is swollen, or it is inflammation, then it means the process of the storage, the storage of sperms is going to be interfered with, and this is very dangerous. So another risk factor is overheating of the testicles. Overeating, a lot of heat on the testicles. I want to say this, anatomically, the testicles are hanging loosely, and they are held by this sac called scrotum. So they are strategically situated or located for optimum temperature regulation. So for example, if they are inside there, if they are still in the abdomen, the process of spermatogenesis can be interfered, cannot be normal, because there are temperatures which will interfere with the process. So very high temperatures will interfere with sperm production, and that's why the testicles are hanging loosely, being held by this scrotum. So for example, when there is overheating of the testicles, now it means the process of sperm production will be interfered with. And what can cause this overheating of the process of sperm production? Like for example, sitting for long time. Sitting for long time will cause a lot of heat on your scrotum, and this can interfere with the process of sperm production. Another thing that can lead to overheating of the testicles is what we call wearing tight clothing. Kuvalia nguo ambazo ni very tight will exert pressure and heat on the testicles, on the scrotum, and the process will be interfered with. And also we have exposure to toxins. Exposure to toxins like benzene, herbicides, pesticides can also contribute to the process to low sperm count. We can also have trauma to the testicles. Trauma, accidents, injuries. We can have injuries to the testicles, accidents to the testicles, which can lead to rupture and many other things. The injuries can also lead to secondary infection. So trauma is also there. Then we can also have family history. For example, if you have history of undescended testes. Undescended testes, I mean the testicles have not descended from the abdomen to the sac that is supposed to help to hold them. Like some people during embryology, during body formation, the organs formation or development, when the embryo is developing, the testicles may fail to descend. It can either be one of the testicles or both of them. They can fail to descend from the abdomen to the scrotum, and so they remain at the abdomen. And there at the abdomen we have high temperatures, which can interfere with the process of spermatogenesis, which is the process of sperm production. So when you have family history of undescended testicles, then chances of you are at a higher risk of having low sperm count. So those are risk factors. What about the ideal causes? Risk factors are just factors which can increase the chances of you having low sperm count. But what about the ideal causes? What can cause these low sperm count? You men, listen to me carefully. So we have causes like varicocele. Varicocele, in simple terms, I will say this: the testicles, there are veins that drain the testicles. Testicles are part of the body organs, and they also need blood supply. So there are testicles, there are veins. Okay, you remember we have arteries and veins. Arteries supply blood, and veins drain blood, which is deoxygenated. The blood that doesn't have oxygen, it is the work of the veins to transport that blood back to the heart and also to the lungs for oxygenation. So the veins that drain the testicles, at some point they can get inflammation. They can get inflamed. And when they get inflamed, they cause this condition called varicocele. So when they are clogged, when they are inflamed now, it means they are going to interfere with the process of sperm production and all that. And this can lead to low sperm count. Yes. Another thing which can lead to varicocele. Varicocele is the inflammation of those veins that drain the testicles, is abnormal testicular temperature regulation. So if the temperatures in the testicles is not properly regulated, then it means we are going to experience some varicocele. We are going to experience a problem in the process of sperm production, and this can lead to low sperm count. We said I talked about infection. I gave an example of orchitis. I gave an example of epididymitis. Orchitis, I said, is the inflammation of the testicles, either one or both of them. Epididymitis is the inflammation of the epididymis, where the sperms are stored. So this infection can lead to inflammation of the testicles of the where the sperms are produced or where they are stored. So when there is infection in either of those parts, then we are going to have low blood count. I don't know whether we are together. So another cause could be ejaculation problems. Ejaculation problems. I want to say this: a normal ejaculation enables the sperms to get out of the body of a man through the tip of the penis. The sperms come out through urethra. That is a normal ejaculation. But we can have some ejaculation problems, like what we call retrograde ejaculation. That is a problem associated with ejaculation. So what is retrograde ejaculation? Retrograde ejaculation is whereby after man has ejaculated, the sperms don't travel outside the body of that man through the urethra, but instead the sperms enter the bladder. So after ejaculation, instead of them coming out, they go or they enter the bladder. So this is a problem. So it means we are not going to have sperms coming out through the urethra. So we are going to have low sperm count. And what can cause these ejaculation problems? Precisely the retrograde. We can have spinal cord injuries. When there are injuries in your spine, wale watu ambao huwa mnalala vibaya, mgongo mnakunja, when we have spinal cord injuries, then we are going to have retrograde ejaculation. We can also have some chronic conditions like diabetes, DM. It can also lead to retrograde ejaculation. So those are some of the factors that can lead to ejaculation problems. Then another cause could be antibodies that attack and destroy the sperms. Antibodies that attack and destroy the sperms. What are antibodies? Antibodies are cells of the immune system which are aimed at fighting pathogens and all that. So sometimes the antibodies in the body can mistake the sperms for intruders. Yani they can have a false identity. They can perceive them as foreign. Wanaonekana kama ni wageni, hawastahili kuwa pale. So when the antibodies recognize the sperms like as intruders, as foreign substances, then they can mistakenly start destroying them. So there will be massive sperm destruction. Now, this will definitely lead to low sperm count. So sometimes the antibodies, the cells of the immune system, can fail to recognize properly the sperms. So they will recognize them as intruders, and they will start destroying them, and this will lead to low sperm count. And also we can have tumors. Tumors are growths, cancerous growth. It can be benign, it can also be malignant. Benign, it means it's not cancerous. It can't lead to cancer. But malignant tumors, they can lead to cancer. It can lead to testicular cancer. It can lead to cancer of the prostate. It can lead to cancer of the epididymis. Any cancer that can affect the reproductive system of a man. So these tumors can interfere with the process of sperm production, and this can lead to low sperm count. I talked of undistended testicles. I explained that the testicles can fail to descend to the scrotum. Zinaweza kwama uko kwa abdomen where there is no the temperature there is not favorable, which will kill the sperms, and at the end of the day we will have low sperm count. And also we can have hormonal imbalances. The hormones in the body, testosterone, when they are not sufficient, it can lead to low sperm count. And lastly but not the least, we can have chromosomal defects. Chromosomal defects, where for example, where a normal man should be having one X chromosome and one Y chromosome. But some conditions like Klinefelter syndrome can lead to abnormality. Klinefelter syndrome is a condition whereby a man is born with 2 X chromosomes and 1 Y chromosome. So a man in Klinefelter syndrome has 3 chromosomes, 2 X and 1 Y. But normally he should have 1 X and 1 Y. So when we have such a defects, it means also we are going to experience some problems in sperm production, which can lead to low sperm count. And having said this, it is good for us to take care, especially to prevent all this. Some of the things here are modifiable. Most of them here are modifiable. Like you can avoid smoking, you can avoid drinking, taking alcohol, you can manage your stress, you can manage your depression, you can manage your testicular temperatures by not sitting for a long time, by not wearing tight clothes. You can modify. Exposure to toxins. I know this is a occupational hazard. It's occupational related, but you can modify. But something like chromosomal defects, it might be hard to modify, but do what you can to prevent this problem of low sperm count. Because when we have low sperm count, it means you are going to become infertile. You are not going to have children. Your ability to give birth to children is going to be impaired. So I want to urge us. But before then, there is something that I forgot to say. This sometimes also we may have problems with the sperm morphology or the sperm shape or the motility, the transport of the sperms. This can also lead to low sperm count, like the shape of the sperm, which is the morphology, and also the motility, which is the transport. How the process of transportation of the sperms can be impaired, and this can lead to low sperm count. So I hope this presentation will be of help to us men. Please, let's take care. Let's avoid also chewing miraa, that fluid that we swallow inside. It's also very dangerous. It will lead to low sperm count. So let's do what we can. Let's also do exercises to keep a recommended weight. Another cause of this, another risk factor, yes, it is overweight. Being overweight or obesity. When you have a lot of kilograms, it means that you are at a higher risk of having this condition, oligospermia. So it's good to keep fit, enda gym, fanya exercises, and it will help you to keep fit, to reduce weight. So usikule tu, unone kabisa without doing some exercises. So it's very crucial that we do this for the sake of our health. So with this, we are going to make sure that no man is going to become infertile. Yani hautakuwa ndewa, tunaitanga hivyo huko kwetu, mtu ambaye hawezi zalisha. So make sure that you avoid these things ambazo tumesema hapa, and I believe that we are going to grow together. Please share this message to your friend, educate them, and let's keep fit. Let's be considerate. Let's modify our behavior. Let's eat well, tukule vizuri. Other men don't eat. You don't eat very well. Umeenda umelewa, ukalewa, umechonga miraa na ukuli chakula. So this is going to hasten the process of low sperm count. So kindly, let's be on watch out. Let's be on lookout, and let's do what we can. So we want to appreciate you. Thank you for supporting us. This is MTUMISHI Ishmael Volunteer Health Talks, MIVHT, an initiative that is coming to you to bring to you awareness of our health. So please support us where you can. We have a channel. Make sure you have subscribed. Make sure that you have clicked the notification bell, so that anytime we post a new video, you are going to be notified. Together with you, we are going to grow, and we are going to make our societies a better place to be in. Thank you so much. If you have questions or comments, please, there is comment section. We are going to post this video. Please feel free to ask your question in the comment section. You can comment, you can recommend how we can make our talks better. Thank you so much. This is Ishmael Mbithi, the founder, MIVHT. Thank you.